Good day, Kavibal, and welcome to our Learn at Home learning session. For the discussion today, the topic will be on recognizing and responding to persons in distress during the COVID-19 pandemic. Before we begin, take note of the following reminders. Make sure you are registered to the webinar to have your e-certificate of participation. Visit certificate.vibalgroup.com to generate your proof of attendance. Share the video using hashtag LearnAs1PH as our official hashtag to our Vibal webinars. Experience learning, Kavibal. And now, to proceed with our webinar this evening, it is my pleasure to introduce to you our distinguished speaker today. Mr. Jonard Bonilla Galicia graduated Bachelor of Science in Psychology cum laude from the Philippine Normal University. He also finished his master's degree in counseling at the De La Salle University. At present, he is currently working as a guidance counselor in the University of Santo Tomas, where he mainly serves as the psychological testing focal person and the e-learning specialist of Counseling and Career Center. He also taught personal development courses in San Beda University and University of Santo Tomas Senior High School. He facilitated several talks and trainings in well-being, educational technology, gifted education, career education, and student leadership. Mr. Galicia is a young professional who hails from the province Kalinga and consistent advocate for mental health and equitable education. Ladies and gentlemen, let us all welcome Mr. Jonard B. Galicia.
Thank you very much for that very generous introduction, Ma'am Jillian. So please allow me to share my screen. All right. So good evening, everyone. Magandang gabi po sa inyong lahat. Thank you very much for tuning in with Vibal Learning at Home webinar series. So tonight we'll be discussing some ways on how we can reach out to those who are in need in this COVID-19 pandemic. So this is just a quick guide or a quick talk for our educators and our dear parents so that we will know or we will have a quick guide on how we recognize and how we respond to persons in distress, to our children in distress, or to our learners in distress, especially in these challenging times. Because of course, we know that when you are emotionally distressed, it can affect our productivity, our functionality, both at home and in school. So this time, I'll talk about some strategies and some techniques on how we recognize them and how we respond them so that we will continue keep going amidst this COVID-19 pandemic challenges. So first question, how are we doing so far? No? So just today, the COVID-19 cases already recorded already reached 850,000 in total since January 2020 from the records of the World Health Organization. What do I mean by this, or what do I need to point out here? There are a lot of people who are being affected by the COVID-19 pandemic. Not just the patients, but also the family members of those people who contracted with the COVID-19 virus. And we know that the consequence of COVID-19 pandemic is not just in terms of physical health, but also in emotional health. And this talk will focus on, how we're going to assist, how we're going to respond to these people who are emotionally distressed. From a local study conducted last January or February 2020, around 16.9% of Filipinos reported depressive symptoms. When we say depressive symptoms, ito yung mga nakaranas ng malubhang kalungkutan, siguro dahil sa pag-contract ng virus, may family member na natamaan ng COVID-19, or yung mga magulang nawalan ng trabaho. So there are a lot of reasons why people may feel depressed or may feel very sad just because of the COVID-19 pandemic. Aside from depression, there's a high number of 28% who also reported moderate to high anxiety levels. Kung sinabi natin anxiety, ito yung takot, the excessive fear. Siguro fear na mahawa sa virus, fear na may mangyari sa sa mga family members nila na nahawa ng COVID-19. And personally ako rin natatakot na mahawa ang mga magulang, mahawa ang mga family members natin. So it's really, it's not really surprising that there are people who may experience anxiety. Last around 13% of Filipinos also reported that they got overwhelmed, they got severely stressed or moderately stressed about the COVID-19 pandemic. My point here is that studies suggest that there are a lot of people who are affected emotionally just because of the COVID-19 pandemic. And today's Araw ng Kagitingan, it's so timely that we make ourselves available or we make ourselves capable in assisting persons who are exhibiting some characteristics of in distress. But before that, I'm going to talk about the individual responsibilities in facing the COVID-19 pandemic. No, nakakatuwa nung inilabas ng Department of Health yung slogan na "Let's heal as one." No, it's a good reminder. It's very inviting to everyone na this COVID-19 pandemic is not just the responsibility of the government, of the medical practitioners, but it needs the collaboration of every one of us, that we need to be responsible enough in facing the COVID-19 pandemic. So in a nutshell, these are the different individual responsibilities that we need to adhere to in order to help our country in facing the COVID-19 pandemic. First, of course, is protecting oneself. No, you protect oneself by following the different minimum health protocol, like wearing masks, wearing your face shield, observe social distancing, and of course, sanitize your hands. Because when you protect yourself, you're also protecting your family members, your friends, your colleagues, and of course, you're also protecting the community to preserve the resources, especially now that our medical resources, like our hospitals, are being overwhelmed because of the continuous increase of COVID-19 cases. Second one is attend to your social roles. What do I mean by social roles? When I say social roles, these are your roles in the society. Being a mother, being a parent to your family, being a friend, no? And of course, being a worker to your workplace. Of course, we need to keep going. We need to have work. We need to keep our economy going because we will exhaust our resources when we stop working. So we can only attend to our social roles if we already integrated the different ways on how to protect ourselves. Again, we can only attend to our social roles when we know how to protect ourselves. And if you're the person who's lucky enough to know how to protect oneself and you're able to attend to your work or to your different roles, then don't forget to reach out to those who are in need. Because it's also a responsibility, no, to reach out to our learners who are in need in terms of emotions and of course, to respond and to assist them and to guide them with the available needs and with the available resources that we can provide them. So this talk will root from that third responsibility to reach out to those who are in need, at least emotionally. Siguro, syempre, madami pang klaseng pangangailangan yung mga may COVID-19, no? And, I mean, yung mga affected ng COVID-19 pandemic, pwedeng material needs, pwedeng physical health needs, no? But this time, I'm gonna talk about how we're going to assist them, no? Emotionally, okay? So the building block or the main or the primary concern now is stress. Of course, it's really stressful to be affected by the COVID-19 pandemic, to follow the different, to follow the different safety protocols that are being implemented. No? But this time, let's talk about, or let's have a quick view, a quick understanding of what stress is. So it's defined as, a condition or a feeling experienced when a person perceives that demands exceed the personal and social resources that the individual is able to mobilize. No? So when you experience stress, it's a condition, and the responses can be emotional and physical. So pag na-stress ka, mararamdaman mo, no? You are having headache, back pain, no? Sakit sa ulo, no? Palpitations, and whatnot. May kasama pang emosyon, gaya ng kalungkutan, no? Katakutan, no? And these emotions or these physical responses are triggered by circumstances, no? Mga problema, mga adversity. In other words, we can understand stress as stress happens when the pressure is so high and the resources is low. So ano ibig sabihin yan, no? Nararanasan natin ng stress kapag yung pressure ay mataas at yung resources natin ay mababa. For example, the status of vaccination in our country, no? The pressure that we need to save the Filipino people, no? The pressure that we need to fight COVID-19 because a lot of things are being affected is so high. But the resources for vaccine because of supply shortage, no? Ay napakababa. So the result will be is high stress, no? Kasi limited ang ating resources pero mataas yung pressure. Same din sa ating mga estudyante. For example, no? Yung estudyante may homework. You need to create this output after 7 days, no? 7 days is part of the resources. Siguro magagawa niya yung portfolio after 7 days. Pero kapag low ang internet connection, stable ang internet connection, mababa ang resources. But the pressure to get a good grade or a passing grade is there. The pressure to submit the requirement on time is there. Pero dahil mababa yung resources, mataas din ang ating stress levels. But if our resources is good enough that can withstand the pressure, then the stress can be also overcome. Okay? So that's a quick view of what stress is. Na dun nanggagaling yung emotional distress. Okay. The next question is, how can we spot signs of distress? This time, no, maraming screen time yung mga tao, maraming communities ang pinupuntahan natin like the social or the internet community. So let's include the virtual setting as part of the avenue where we can spot signs of distress, no? So virtually, marami din tayong makikitang signs or indicators of distress dyan sapagkat the screen time of people is increasing now, no? Maraming tao nasa Facebook, nasa Twitter, nasa internet. And if there are a lot of interactions there, it's very possible that we can also spot signs or indicators of distress virtually. Lalo na ngayon, maraming schools who are delivering instruction through online. Of course, nandyan pa rin naman yung physical avenue where we can spot signs of distress. Kaso nga lang ngayon, sa classroom, wala tayong makitang spots or signs of distress sa classroom sapagkat wala namang face-to-face classes. But for our dear parents, we can help our children or our kids to overcome this distress by being vigilant enough in observing some signs of distress physically. Later on, I'll be suggesting some specific spots or specific avenues where we can get or where we can observe signs of distress. And the third one is self-disclosure, no? Ang self-disclosure, ito yung target natin sa isang family, sa isang learning community, no? Na hindi na natin kailangan mag-spot because our students, our children are ready enough to report their problems when they are overwhelmed by it, when they experience it in a difficult way. Okay, so that's our target in our family, in our classrooms na we need to train our students to disclose their problems kapag nahihirapan na sila and they are overwhelmed by it para hindi pa mag-escalate into other levels. Okay, so these are the different spots, specific spots where we can discover indicators of emotional distress, no? But these spots are just some but not limited to. Okay, marami pang hindi tayo na-include, no? So virtually, social media feeds, no? As a parent, no, it's also good to open their social media profile, no, their feeds of what they share, of what they upload in social media, no? Kasi the change of profile picture alone as a teacher, kapag nakita mo na change ng profile picture yung estudyante, if you are friends with them, if they allow that, no, it's already an indicator na may pumanaw na, no? Sobrang laganap yan sa Facebook ngayon. Maraming change ng profile picture because of the increasing number of fatality cases related to COVID-19. No? So sa social media, no, marami tayong makikita na indicators of emotional distress, the things that they share, the things that they upload, no? Second one, social media reactions. Yung aggression ng tao nakikita din sa mga social media reactions like their comments on Facebook, no? Maraming mga keyboard warrior, no? Pero of course, there should be a pattern and it should be excessive, no? Ano ibig sabihin na, no? Kapag malala ang kanyang interact sa social media, then it can be a sign of emotional distress. Pero pag minsanan lang naman, then that's not a clear sign of emotional distress. Browser history, no? For parents, no, it's good to check the browser history of our children. But of course, we respect the privacy of our children. But it's also good to set an agreement, to set a reminder with your children na there are times that you need to review their browser history. Lalo na pag alam mo na vulnerable yung anak na makapag-experience ng mental health problems. So we need to make an agreement with the child, with your son and with your daughter na anak, there are times that I need to visit your browser history for me to know what's going on with you in social media, what's going on with you in the internet world. Okay? Sa browser history kasi marami tayong makikita ditong signs of distress, lalo na sa Google search history, no? Parang sinesearch nila what's the meaning of life, no? They also search some ways on how to harm themselves, and they search things like paano ba maging masaya ngayon, no? Paano ba makatulog, no? Those are search histories or search indicators na may emotional distress yung bata, no? It's not a conclusion, but it's just an indicator, no? It's just a reminder or a warning sign, no? So let's be clear on that, no? An indicator or a warning sign is not the same with a diagnosis, no? So pag warning sign, wala pang conclusion na may problema yung bata, no? It's just an indicator that there's something wrong going on. When you also deliver online classes for teachers, like non-verbal cues observed through web cameras can also be helpful in discovering indicators of emotional distress. Lalo na sa camera, no? When we see na yung bata constant palagi nang nag-a-attend ng klase na hindi maayos yung physical presentation niya, because of course our children are being reminded na when they attend asynchronous classes, they need to make themselves present in a pleasant way, no? So kapag may mga bata nakita mo na hindi maganda yung bihis, no, hindi nakasuklay, palagi na lang ganon, no? There could be something wrong going on. So those are some of the indicators of emotional distress. Physically, especially to our parents, kasi kasama natin yung mga anak natin at home. So these are the possible spot areas where we can identify signs of emotional distress. Una, bedroom, no? Bedroom, dito natin makikita yung patterns of self-management. Paano yung tulog, no? Di naman kailangan pumasok. We can see the lights, no? We can sense the movements or the activities inside, no? Pag nakita mo 1 a.m., 2 a.m., palagi na bukas yung ilaw, may naka-play na music, may mga gumagalaw, it's already 2 a.m. at palagi naman na nangyayari most of the days, then there could be something going on wrong with the sleeping pattern of your child. Kung ayos na rin yung bedroom, pagkita mo palagi na lang magulo, no? Na hindi naman ganun dati. And that could be a pattern of problems with self-management. Living room, common areas, these are the interactions and reactions. No? Dito nakikita yung mga interactions and reactions. Nakita mo ba yung anak mo kapag nasa sala, no? Walang gana, makipag-usap, no? Yung reactions may be aggressive, irritable, no? So these are the possible avenues or possible things that we can observe from those areas. Third one, dining, kitchen. Dito natin makikita yung eating patterns, no? Na nakita ba natin na may changes sa eating pattern ng ating anak na biglaan na lang na palaging bumibisita ng kusina, kumakain ng marami, tuwing mealtime, sobrang daming kinakain, no? And it could be a sudden change sa kanyang eating behavior. So there might be something wrong going on. Or pag nasa kusina, walang ganang pagkain, no? O hindi na pumupunta sa kusina para kumain because they lack appetite to attend to their meals. Okay? The third one, study rooms or areas, no? Kahit naman walang study room, I'm very sure na yung mga anak natin, no, they identify places where they work on their academic requirements. Pwedeng table lang, pwedeng part ng sala. At doon nilalagay yung mga gamit nila, yung mga modules nila, yung mga libro nila. No? Doon nila nilalagay. And dito natin makikita yung academic functionality. No? I'm not saying na totally dito natin makikita, but it can give you a clue. It can give you an overview of what's going on with the child in terms of academic functionality. No? Pag nakita mo naman na Parang walang nagagalaw sa table niya, parang walang gumagalaw sa mga libro niya, no? Walang gumagalaw sa mga learning materials niya. Baka academic break. So, wag naman mangamba. Pero pag alam mo naman na yan ay finals week, no? Maraming mga submissions, maraming mga performance tasks na kailangan i-submit. Tapos nakita mo yung table niya, walang gumagalaw, walang natatapos, walang masyadong nagagawa na outputs, then you have to be vigilant about this and talk with the student. Mamaya sasabihin ko kapag meron itong mga indicators na ito, anong pwede natin gawin? Okay? And that's the response part. Okay? Self-disclosure. Nasabi ko na kanina na when we foster the culture of self-disclosure in our family and in our learning environment, it really helps a lot for the people to ask help when they are overwhelmed by their problems. So as teachers and as parents to our children, we should provide avenues for children and for students to self-disclose. No? For example, when we have online classes, no? Pwedeng may kumustahan din afterwards, lalo na pag after finals week. No? Let's have a group kumustahan. No? If you're a parent, no? You can also visit them in their rooms, no? After meals, or at 9 p.m. after ng kanilang meals, you can go there. You can go with them and ask some questions. Oy, kumusta ka? Anong nangyari sa classes mo? Those are avenues for self-disclosure, no? Para at least we are, updated with the progress of our students in terms of their academics. Okay, so again, these are the common spots or common areas where we can discover indicators of emotional distress. So, what are the things that we need to spot? No? Ano ba yung mga hinahanap natin, no? sa mga batang may emotional distress? No? So there are two types of behaviors that we need to spot. No? These are atypical behaviors and unusual behaviors. When we say atypical behaviors, ito yung there's a sudden change from the usual. For example, itong bullet number 1, no? Nakita mo yung estudyante na palaging nagsasubmit ng magandang work, no? Sobrang quality yung mga outputs niya, quality yung mga performance tasks niya. But after a month, nakita mo that there's a sudden change sa quality ng kanyang output. We call them atypical behaviors. Kasi emotional distress, we can trace that from a sudden change of their usual behaviors. Second bullet, abruptly begins turning in late assignments. No? Dati on time nagsasubmit, pero biglaan, no? Biglaan after that, may late na ang kanyang pag-submit. So there could be something happened, no? Na naka-trigger sa kanyang functionality. Becoming disrespectful, okay? When they communicate with you, when they discuss during online discussions, hindi maganda yung pagsalita, hindi maganda yung pag-address sa classmates and sa teachers, or to you as a parent. That can also be a sign of a typical behavior. Stops responding to communications. Marami to, laganap ito, no? Ngayon na online learning, hindi nagre-respond sa mga emails mo, hindi nagre-respond sa mga text messages mo, or they don't go to school to just get their modules, no? So there could be something that triggered their functionality again in school. Content of work becomes negative, dark, odd, and tone. Okay? So when they submit modules, siguro may mga outputs tayo na let's make an essay, let's draw like this, no? From these outputs, we can also recognize some indicators of distress, no? Kapag nakita mo na very negative, very pessimist yung theme, very dark yung of course colors, dark yung tone, no? Na sobrang very down na yung emotions ng kanyang essay. Okay, so this can be, indicators of distress. No, unusual behaviors. What are the unusual behaviors? No, these are when we compare it to the norm, I should say. These are the unusual behaviors. Now we cannot. It's not really unusual. It's not actually atypical, but it's unusual. Like for example, disoriented during discussions and output contents. No, hindi makafocus. Hindi siya present-oriented, hindi alam yung reality. Pag may tanong ka, hindi alam kung saan yung lugar, hindi alam yung pinagsasabi, and this can be unusual behaviors. Why this is important? Kasi ang atypical behavior kasi usually they can predict emotional distress. But when they exhibit unusual behaviors, they can already predict some clinical levels of distress. Kaya mahalagang mahalagang makita natin yung pagkakaiba ng atypical at unusual. Kasi pag atypical lang, pwede na emotional distress lang yan. No? It can be managed by the help of friends, the help of counselors, or the family members. Pag unusual na kasi, there's a possibility that it can elevate to a clinical level of distress. Emails, chats, text messages are manipulative, accusatory, sexually inappropriate, or threatening. These are not the normal reactions from students during online classes. Or a student clearly seems out of touch with reality. Pag nag-submit ng mga outputs na they are away from the reality, hindi sinasagot yung tanong, pero it's out of the world yung mga responses, this can be examples of unusual behavior. So let's move on to the second part of the discussion. This is how to respond with students or with persons who are emotionally distressed. So my slide says, talking with a distressed person is a helpful way to respond them. So I'll be focusing on how to talk with a distressed person as a helpful way to respond to them. Okay, so when we talk with a distressed person, if you notice, I highlighted the word with as you talk with a distressed person. Because when you talk with a distressed person, it should be a two-way interaction between the person who is helping and the person who is in need of help. Dapat most of the input, most of the conversations ay nanggagaling sa distressed person. Kasi iniiwasan natin na magkaroon ng advising, no? Magkaroon ng pangangaral during the sharing of the distressed person. Because we need to understand the story first before we go deep in helping them. Okay, so again, just be reminded when you respond to them, the main goal is to gather the story, and the main goals are this: you listen to them, you acknowledge, you support, and you connect them to the appropriate help available. So I'll be discussing how you're going to acknowledge them, how you're going to support them, how you're going to connect them. I'm going to share some specific strategies and techniques on how you acknowledge and how you support and how you connect persons who are in distress. Okay, first one, acknowledge. Okay, I'll give you the skills of PEAK. No, if we say PEAK, okay, as in PEEQ, P as paraphrasing, E as empathizing, and E as encouraging, and the last one is Q as questioning. When we talk to them, okay, when we listen to their stories, we should not barely listen lang, no? Kailangan din may reactions from our part. And we do those acknowledgement, we do those interactions by paraphrasing, empathizing, encouraging, and questioning. I'll be discussing them one by one. So when we do paraphrasing, the main goal is that to give a feedback to the person, the essence of what has just been said, no? Kasi nakakatuwa no when nag-share ka ng story, tapos na-validate mo, na-verify mo na yung sinishare mo ay naiintindihan ng kausap mo. And that's the goal of paraphrasing. You let the person who needs help or the person who is sharing na naiintindihan mo yung essence ng kanyang sinasabi. When you paraphrase, there are different parts of a statement. When you paraphrase, this include a stem, a key thought, and a checkout. Yung stem, ito lang yung introduction na, for example, no? Our example here is that, Mirna, the situation looks like this. This is a stem. It's like an introduction before the key thought. And a key thought is, ano ba yung essence ng kanyang sinabi? No? Ano ba yung pain point ng kanyang sinabi? And the last question is, did I get it correctly? To verify kung tama din naman yung naintindihan mo. Okay? Kasi you know what? When we paraphrase things and the student in need ay naintindihan niya na or nalaman niya na naintindihan mo yung pinagsasabi niya, it's relieving, no? It provides relief sa part ng estudyante. Kasi you know, most of their beliefs, no, most of their statements, sinasabi nila na I don't want to share because nobody understands me. But when you let her or him aware na you understand what they are sharing, then it can provide relief sa part ng estudyante. So after paraphrasing, we have empathizing. No? So pag nag-share yung bata, you acknowledge them through paraphrasing. Next is empathizing. Kung ang goal ng paraphrasing ay para sabihin sa nag-share na naiintindihan mo, ang empathizing din naman ay to let the student understand that you are aware of what they feel. Kung yung essence, yung gusto nating paitindi sa paraphrasing, sa empathizing naman ay yung feelings, no? So we let the share to become aware na naiintindihan natin yung nararamdaman nila. For example, what are you going through is really challenging. Understand why you feel that way, no? So, pwede mong sabihin na kung siguro nandyan din ako sa kalagayan na yan, mararamdaman ko din yung emosyon na yan, no? If I experience the same situation, I might also feel sad, no? So that they would understand na, oh, man nakaka-relate sa akin, no? So, by that alone, no, nakakatulong sa relief ng feelings ng mga students na nag-share. Okay. Third one is encouraging. No? Encouraging, you don't need to talk, but you need to react. Okay? These things we need to do when we encourage is, of course, the primary goal is to let the student feel that you are interested of what he or she is saying. Encourages include head nods, gestures, and appropriate facial expressions. No? Siyempre, mahahaba kasi yung mga kwento minsan. And they might think na you are not tuned in because their stories. So when you do head nods, when you do gestures like you understand what they are saying, this can be helpful and this can be encouraging on the part of the sharer to continue and to think na there are people who are relating to them. Next is questioning, no? Lalo na sa last part, no? Ang goal kasi ng questioning natin is to gather the most basic and relevant information. Be careful tayo sa questioning kasi minsan we question things na we give questions na mas nakaka-trigger ng mga negative emotions. So we can do questions like who, what, and when. Okay? Huwag tayo magsabi ng question like, kung kaya ginawa mo yung output na ito, ano kaya nangyari sa'yo? So those are, guilt-tripping questions, no? Or pwede mong tanungin na bakit mo ginawa yan? Bakit nangyayari yan sa'yo, no? Those are, in-depth questions that can trigger negative emotions. We can only do questions na makakapag-inquire ng basic information na magiging basis mo sa pag-connect ng help afterwards. Okay, so the last part, the second to the last part in responding to them is to do a support. How we support students in distress. We follow the GROW framework. Okay, when we say GROW, we need to have the goals. We'll do the reality check. We have the options and the way forward. For the goals, just inquire about their needs. No, dapat malaman natin kung ano yung need niya, anong pangangailangan niya. So after the needs, we need to do a reality check. Yung needs niya ba ay possible enough to respond to, no? Kasi baka naman yung pangangailangan niya ay walang solusyon. So in reality check, we need to help the student figure out kung possible ba, controllable ba, manageable ba yung need na identify niyo. And of course, you have to evaluate the urgency of the concern. Kasi baka mamaya yung kailangan niya ay emergency and we need to connect them to people who can give emergency attention. Third is options, no? Kapag teachers ka, pag teacher ka, you can discuss the options that you have in school. You can connect them to the counseling office, no? You can connect them to the teachers na pwedeng mag-assist sa kanilang problema. No? You can connect them to the offices who can also respond to their queries. Pag ikaw naman yung nanay, of course, or your parent, no? May mga options na pwede mong sabihin in a more personal note, no? For example, pwede ka naman pumunta sa bahay ng lola mo during these classes para mas malakas yung internet mo. Those are parts of the options, no? And way forward, this is the connecting part, no? You connect the student or you connect the child to the appropriate help, no? Kapag kailangan i-refer ba sa counseling center, kailangan bang i-connect sa psychiatrist kapag may mga escalated emotional problems. Or if you're a mother, you can already respond kung ano bang material help, ano bang emotional help yung kailangan niya. Okay, agreement ba yan? Materials ba yan? And so on and so forth. So this is the last part of my slide. Okay, so what are the important considerations when we talk with a distressed person? Napaka-importante nito, no? So first one, sense of autonomy. We should respect the autonomy of the person in distress, no? Huwag natin pilitin na mag-share kung hindi pa sila ready. No, huwag natin pilitin mag-share kung they don't want to share anything about their problem. Second is readiness of persons in distress. No? We have to consider that na may mga tao na mas nakaka-share kapag ready sila. Like for example, tama yung lugar, tama yung oras. If you're a parent, no, tapos nakita mo yung anak mo hindi nagsasalita habang kumakain, and nandun din yung ibang family members, I think it's not an appropriate avenue na magtanong, na magkwento yung bata about their concern kasi maraming nakakarinig. Same din with our teachers when we having asynchronous class, pagkwentuhin mo ng problema, yung bata during asynchronous class, of course, it's not an appropriate avenue for them to share personal stories about their problem. Third one, confidentiality. That's very basic, no? Now, when someone shares personal stories about their concerns, we need to observe confidentiality. What do we mean by confidentiality? Every information that has been shared during the session or during your conversation with the student should only stay between the two of you. Okay? And the last one, awareness of boundaries and limitations. No? As parents and as teachers, we need to be aware kung ano ba yung boundaries ng kaya nating ibigay sa estudyante. So reminder dito, huwag tayong mag-promise dun sa options ng mga option na hindi naman natin kayang ibigay o hindi naman natin kayang i-provide sa estudyanteng iyon. And limitations or boundaries of our capabilities. If we cannot do counseling, then don't do counseling because there are appropriate persons who can do that. Same with psychotherapy. Okay? So this is also a reminder to everyone na pag may emergency concern, you can provide them the helpline of the Department of Health, the National Center for Mental Health. So this is a Luzon-wide landline toll-free. The mobile numbers, okay? So we will check if these things are functional, but if there are emergency situations, you can call emergency hotlines in your community. No? Lalo na pag may threat to life, like for example, self-harm and whatnot, we need an emergency response to them. So it's also important to register the contact numbers so that we are ready whenever there's our emergency situations. So thank you very much for listening to this discussion. I hope you're able to learn some basic concepts on how we're going to recognize some indicators of distress and how can we respond them. Thank you very much. Stay safe and stay hopeful.
Thank you very much, sir. Do you have any last reminders to our viewers for today po?
Of course, yun pa rin, we have to adhere to the safety protocols. We need to protect ourselves, to protect our family members, and of course, the community. And make yourself empowered to be ready enough in helping the people who are in need, because these problems shall pass. No? Yan lang, Ma'am Jillian.
There we have it. In behalf of Vibal Group Incorporated, I would like to thank our speaker for today for this very eye-opening and insightful learning session. It is an honor to have you with us today, sir. And to all our Vibal viewers, all thanks to you for your continuous patronage to our daily learning session. Don't forget to register to get your e-certificate of participation. The link is in the caption of this webinar. We also encourage you to subscribe and watch on our official Vibal Facebook and YouTube channel. Muli, maraming salamat at magandang araw sa ating lahat.